Welcome to Ask Your Pediatrician, and of course, today we get into another infection that usually affects young children. Remember that last week I did point out that we're going to look at a series of infections in the next few weeks. And of course, every week we're going to be looking at one particular infection that seems to be a problem, especially during the period when a child is growing. Last week we were looking at UTI infections, and of course we discussed quite a lot when it comes to that. And today we venture into something different. Today we want to take a look at a diarrheal infection, and I am joined by Dr. Jombo Namushi, who is a consultant pediatrician from UTH at Children's Hospital. Doctor, welcome to our program today, and of course, good to have you.
Yeah, thank you, Nelson. Good afternoon, viewers.
First things first, what is diarrhea?
Okay, so diarrhea really it's a very common disease, and oftentimes it's something that we don't even bother to define. But of course, there is a definition for diarrhea. So basically, diarrhea is passage of unusually loose stools of more than 3 episodes in 24 hours. So if a child passes stools that are unusually loose, and the mothers usually are able to tell, because take for instance, the consistency of stool varies with age. For the relatively young ones, these are the infants, those are less than 1 year, those where the stools are not as hard as adults. But even when the stools are a bit softer in that age group, the mothers are able to tell, to say, no, these stools are unusually loose. Okay, and basically what we define as loose stool, this is stool that if you are to put in a container, it will take the shape of the container.
Okay.
Thank you.
Interesting. Obviously, just going to the toilet and you're passing, or a child is passing soft stool, once in a while, a child might have soft stool that looks diarrhea-ish and stuff like that. So how can a parent know that this is diarrhea?
Okay, so basically the key word is unusually loose stools, because remember, these mothers are very familiar with their babies, and if they see that there's anything that has changed from the usual, they're able to tell. So take for instance an infant, as I mentioned, the stools are relatively on the softer side because of the sort of food that they eat, because mainly it's breast milk. So the stools are not as hard as what you'd expect maybe in an older child. So if the mother noticed that that usual softness is not there, it's unusually loose, and a child has recorded 3 or more episodes in a 24-hour period, then that qualifies to be diarrhea. So the consistency and the number of motions, those are very important to look at. Interesting.
In a child, what really causes diarrhea?
Okay. So really, you will appreciate that diarrhea is generally under 5 disease. So it's quite common. And in that age group, there are quite a number of things that can cause diarrhea. But the commonest cause is rotavirus. There is a virus among the main viruses that is called rotavirus. And it's for this reason that in our current EPI, which is basically an expanded program for immunization, these vaccines that we give children every often at certain specified intervals, the rotavirus was actually introduced because it was noticed that actually most of the diarrheas that occur in under 5 children are due to rotavirus. Of course, there are other associated factors.
Okay.
Yes.
Interesting. And what are some of the symptoms that can help a mother, a father, get to know that this is diarrhea?
Okay, so really, as we did mention from the definition, that actually it's just loose stool, unusually loose stool. So the first episode, mothers usually just observe. But even from the first episode, we always advise mothers not to be casual or caregivers, because actually some of the stools, even just from one episode, they are so bulky that a lot of fluid is lost at once, and that can compromise the health of the child. So in as much as we emphasize on the 3 episodes, in terms of intervention, they need to start as soon as possible. Each time a mother sees that the stools are a little bit loose than usual, then giving of extra fluids should commence. But not until the 3 episodes have been met, that qualifies to be diarrhea. So of course, in terms of some of the signs and symptoms, in as much as we are talking of acute diarrheal disease, that can be associated with other things like vomiting. Okay, so sometimes the child would come with vomiting, and it's not uncommon to see a child actually in the morning is having a bit of vomiting, and then later on in the day they also develop diarrhea. So that vomiting actually was just the initial symptom of that acute diarrhea episode. And as we mentioned also, because it is an infectious process, some children actually would have fever also. Okay, so basically for diarrhea, it's mainly the loose stool, could be associated with vomiting and also fever. So once those are there, then probably it's infective diarrhea.
What are some of the risk factors that may actually predispose a child to, developing diarrhea?
Okay. So you realize that by and large, all things that have to do with diarrhea is actually through the things that enter through our mouths. Okay. So basically, the biggest risk factor for diarrhea is personal hygiene, water, and sanitation. Okay. So basically, whenever there is an episode of a diarrheal disease, then whatever is causing the irritation or causing the diarrhea should have entered through something that the child could have eaten or something the child could have drank. Even rotavirus, which is quite common, it also enters through the mouth. And there are several other causes of diarrhea in terms of organisms. I'm sure in Lusaka we are aware that there's been an epidemic of typhoid that had been ravaging our communities for some time. All that causes diarrhea and enters through the mouth. So basically the biggest risk factor for diarrheal diseases is suboptimal access to clean water and sanitation. And for mothers also, for young babies, there are also other critical things that also are risk factors. Take for instance, we did mention immunization. So for those babies that are not immunized against rotavirus, they are at risk of rotavirus-associated diarrhea, and if they do, the diarrhea tends to be very severe. It's not that those that are vaccinated might not have the episode, but the risk is less. And if they do have an episode of diarrhea, that means it might not be that severe. So that's one of the things that immunization does. The other risk factor is lack of breastfeeding. We know that breastfeeding is protective against diarrhea, also because when it comes to breastfeeding, it's quite hygienic. As compared to a baby who's on formula, they have to prepare, it depends on how they handle the bottles and how they handle the actual feed. So also lack of breastfeeding is a risk factor for diarrheal diseases. And then we did mention things of access to clean water. That quite a number of our communities, they don't have access to clean water. And that's one of the biggest risk factors for almost all diarrheal diseases. And then we come to talk of sanitation. So basically sanitation is just the cleanliness in the surrounding vis-a-vis excreta disposal. I'm sure recently you are aware we had a very huge ravaging cholera outbreak. All those issues border on suboptimal sanitation. And then also, of course, when it comes to children, also nutrition. Nutrition is very important in maintaining the immunity of the child, and also because also the intestines also, if they are not healthy, then that child is at risk of diarrhea. So meaning malnutrition also is another risk factor. And then also we talk of vitamin A deficiency. We know that in Zambia we have got a child health program where we do these cyclical interventions for children, which we call the Child Health Week, which comes every 6 months. And one of the things that we do during that time is vitamin A supplementation. So we do give these babies vitamin A time and again. Because when babies are deficient in vitamin A, it means their gut is not going to be healthy and can easily be invaded by bacteria, and also they can easily have diarrhea. So basically those are some of the critical issues that are risk factors for diarrhea. And if you look at all these, they're relatively very preventable risk factors. But sometimes it is said that familiarity brings contempt. We are so familiar with diarrhea and people take it so casually, but we do realize that actually diarrhea, globally, that is world over, actually even in Zambia, is the second leading cause of under 5 mortality. That means it's one of those diseases that kills a lot of children. It's actually second to pneumonia. Of course, in Zambia, top on the list is pneumonia, diarrhea, and then malaria in terms of killing children. So you could see that actually diarrhea is a very huge problem. And actually because of this, WHO in 2012 came up with what they called the GAPPD, which is the Global Alliance for the Prevention of Pneumonia and Diarrhea. So you could see that it's actually a huge problem.
Okay, interesting. All right, so now, having said all that, let's talk about, diagnosis. How is diagnosis done when it comes to diarrhea?
Okay. So diarrhea is basically a clinical diagnosis. What do I mean by clinical diagnosis? So basically, you just elicit from the signs and symptoms that the parents are telling you, and then from there you can deduce that this is diarrhea. But of course, we could go a step further now to see what is causing this diarrhea. Because remember, I didn't mention that there could be so many causes, which could range from viruses, bacteria, parasites. But of course, suffice to say that in children, the commonest, as I mentioned, is rotavirus. Of course, there are other bacteria. Take, for instance, cholera is a bacteria that causes diarrhea. It can affect anyone. We have other organisms that cause dysentery. This is blood diarrhea. We have other organisms that cause typhoid. They are all typhoid bacteria, but virus families. So basically, the diagnosis itself to say that this is an acute diarrheal disease in a child is just clinical. Just from the signs and symptoms the mother tells you. The child is having loose motions of more than 24 hours, which could be associated with vomiting, sometimes with or without a fever. That in itself is enough for us to make a diagnosis of an acute diarrheal disease. But of course, all other investigations that follow is just now for us to be a bit more specific, to say, okay, now what could be causing the diarrhea in this child? And the specific tests that could be done vis-a-vis to detect whether it's rotavirus, whether it's typhoid, or several other organisms. Okay. So in which case, some of the diagnostic tests that we could do is just like to get the same stool and take it to the lab. And in the lab there, they can look at a number of tests. But of course, that often is for that diarrhea that we think it's not a usual diarrhea. Because basically, if you look at diarrhea, it is classified into acute, and then we've got persistent. And then in the past, we used to have chronic, but now by the time a child's going into chronic, they've been developing malnutrition. So that falls in diarrhea with malnutrition. So basically, we only worry to start doing sophisticated investigations when the diarrhea is becoming persistent or going into maybe leading the child into malnutrition, in which case, to an extent, is becoming chronic. Okay, but otherwise, acute diarrheal diseases, most of them, we just make a clinical diagnosis based on the symptoms and we treat, and most of the children basically actually respond very well.
What are the chances that when a child has developed severe diarrhea would survive?
Okay, so as I mentioned, diarrhea is one of the leading causes of mortality among children. One thing that I would say is that diarrhea is a very, very, very treatable and preventable disease. That's why actually in the Global Alliance for the Prevention of Pneumonia and Diarrheal Diseases, WHO and other partners envisage that actually we could prevent or eliminate all preventable causes due to diarrhea and pneumonia. And because it has been identifiable that most of the deaths due to diarrhea would actually be prevented. And this is evidenced by the fact that in developed countries, diarrhea is not a concern as far as under 5 mortality is concerned. So most of the deaths that occur from diarrhea actually occur in poor countries like Zambia. And actually 90% of the diarrheal deaths occur in Africa and Southeast Asia. So you can see that if other people are developed, they're able to almost eliminate deaths due to diarrhea. Why can't we? So basically, the risk is there because, one, delayed intervention or seeking care. So these mothers, the child will have one motion, they're seated at home, another motion. By the time the child is come to the hospital, the child is severely dehydrated. And the major cause of death in diarrhea is the same dehydration and nothing else. Not necessarily the diarrhea itself, it's actually the loss of fluid. That is what kills most of the children. And if you let the child lose a lot of fluid without any intervention, then the risk of death is very high.
You're still watching Ask Your Pediatrician, and of course, we are discussing diarrhea. For your contributions, you can come through on 0955 5016, 0955 5016. In case you have got any question, anything that you'd want to find out, definitely you can send us a text on that number, and we should be able to respond to you. Just for now, we go for a break. We'll be back shortly.
Get 25 minutes, 100 MB, and 1,000 SMSs for 5 kwacha on Airtel to Airtel, and for 6 kwacha on Airtel to other networks. Get Get 25 minutes, 100 MB, and 1000 SMSs for 5 kwacha on Airtel to Airtel. And for 6 kwacha on Airtel to other networks, get 20 minutes, 100 MB, and 100 SMSs. Valid for 7 days. Airtel, the smartphone network.
Why? Why does it have to be standards?
It's the same as a guy is gonna come back to his friends. No, I slept with this guy, this girl, and that girl, and that girl, and
She's such a
gay.
gay.
No, for him,
He's not even a G. He's a stupid boy.
Yes.
How is he a stupid boy?
Listen, why would you brag about?
Let me tell you. I always have an excuse.
Men are usually awarded for their nonsense.
3/4.
You
think so?
That's what it is.
You think so?
I know so.
Okay. All the best. Now,
That's it.
So I can literally get into your house and tear it down because I ran it.
Yes.
You owning it.
Girl,
It's
power.
nothing.
listen. No.
It's
I
not
think
back to
no.
your house.
These
You
are
own
ills
a
we need
house,
to
I
correct.
ran it.
So what?
I
What
can-
you're saying, guys don't know how to cook? No.
I don't think she
Like
meant that
you're a guy out
literally.
there and you don't know how to cook. Please get my number. Guys, no.
She's advertising yourself. Are you Jeremiah? Are you single?
Yes, boss. We have 3 women on the show and 2 guys, but you still know we got it.
Exactly.
Lots of love to QTV. Love you.
Hi, welcome to Street Buzz.
The minds are getting affected because alcohol kills some neurons in the brain.
Why is it a bad thing?
Because it's provide a cancer.
It passa cancer.
Yes.
Mwempondo keep watching Street Buzz. This is Street from Intercity. Epona Pereira Bapeni QTV International.
Hello. Hi, guys. Hello, beautiful people. Very best of entertainment, fun, excitement, and everything LSK.
Everybody who's in Zambia, you're Zambian too, you know what I mean? So, yeah, man, we're just so happy.
All right, so welcome back, ladies and gentlemen. All right, so now, Doctor, having said and of course highlighted the seriousness of diarrhea and why it needs swift attention, what should be the first response when a mother, a father realizes that their child has diarrhea?
Okay. So as I mentioned, the hallmark of a diarrheal disease, or basically the disease process and how it brings about problems and causing death of children, I did mention that what causes all the problems is actually dehydration. So actually, the first thing or the priority in attending to a child with diarrhea is fluid replacement. Okay. That's why even WHO has stipulated what is called the 7 points in the prevention and management of diarrhea. And top on the list is fluid replacement. So basically, a child with diarrhea, by the time that they are seeking care, by the time they are coming, in terms of dehydration, they could fall into 3 categories. Either at the time they are coming, they don't have dehydration yet, but they're only having losses. Or by the time they are coming, they have some dehydration. Those that we indicate as having some dehydration, it's the child who has lost about 50 to 100 mils per kg body weight in terms of fluids. And then we have those that come in very severely dehydrated. So actually, we don't want mothers to wait until a child is severely dehydrated before they start intervening. So even from the first episode of a loose stool, we want mothers or guardians to start instituting fluid replacement. And ORS is accessible everywhere, from the local clinics, from the local pharmacies. It's actually not a prescription drug. And actually, the ORS that we have now has improved so much. It is what is called actually low osmolarity ORS. It's very good. And once a child has got an episode of diarrhea and mothers or guardians start instituting fluid replacement ORS, then the child might not even need an hospitalization. But the problem that I did notice during my study as a postgraduate, actually I looked at diarrheal diseases. And actually, I was amused to realize how the low usage of ORS is in our community, despite its wide availability. Actually, I did note that the usage was as low as 40% by the time a child is reaching a tertiary care. So that means actually, even in the local clinics, the ORS was not instituted. And those children actually who delayed to have ORS instituted actually had a higher risk of death than those children where the ORS was started on time. So the biggest thing that needs to be done in a child who has diarrhea, even from the first episode, is fluid replacement. And oftentimes there are all these myths that people have in the community thinking to say, no, this child has diarrhea, probably it's something that the child ate, and in the period that the child has diarrhea, they want to feed less because they think that each time they feed, the child might have diarrhea or it might worsen the diarrhea. Actually, it should be the opposite. When a child has a diarrheal disease, they need to feed a bit more so that the nutritional status of the child is maintained. Of course, if they come late and the child has gone into dehydration, we usually rehydrate over a specified period of time, which is usually 4 hours. We give a calculated volume of ORS over 4 hours. And in that period, if it's a non-breastfeeding child, would rather that they don't feed, because no, it's one stomach that we are using to give the fluid and also to give the food. So if you give the food in that period that we are hydrating, it might end up compromising the capacity of this child to take the fluid. But for babies that are breastfeeding, we encourage mothers to continue breastfeeding, even in the time that we are conducting that intensive rehydration. So this is just for those with some dehydration. But any child with diarrhea, still active, playing around, able to toilet fluids, every after a loose stool, they should be able to give at least an estimated of 10 mils per kg body weight. Roughly, this is about those that are less than 1 year, we give them about 100 mils for each loose stool. Those that are 1 year to 2 years, we give them about 200 mils per loose stool. And for those that are above 2 years, we give them a minimum of 200, but we give them as much as they want to drink. Because remember, the way the body is made, once the fluids start going down in terms of dehydration, the body tries to conserve some fluids. So by so doing, the child will urinate less, and also the child will feel thirsty as well, trying to take in fluids and improve the volume. So for those who are slight to order, you give them as much as they want. So in a child who has got diarrhea, the first critical point is fluid replacement, and especially ORS. And this ORS is widely available everywhere. And we do encourage mothers.
On the same ORS, sorry to just to cut you short on
Yes,
that.
please.
I was hoping that you could also possibly add this one up as well. Is it advisable that ORS should be given even when a child is just okay? Or maybe it's just a fluid that should be administered when a child has got diarrhea or when the child is not feeling too well?
Okay, so ORS basically is a drug. It's not a fluid that could be given to a child at any other time, because it has critical ingredients, electrolytes, and of course the water itself that we add. So to say that it can be given at any other time when the child is not sick, I think there are several other alternative fluids that we could give, even in plain water in a well child. But ORS is very good and recommended only for use when a child has got diarrhea, because actually it is a drug.
Okay, interesting. What happens if at all during the same period when the child has got diarrhea, is failing to consume the liquid, is failing to respond, and perhaps has even lost appetite? What happens? What can parents do?
Okay, so basically, from what you are describing, if a child comes in that state, then this is a child who probably is severely dehydrated.
Mm-hmm.
Because actually a child who is severely dehydrated is actually a very sick child. Some of them actually even be unconscious. So actually one of the things that we use to assess the hydration state of a child is actually the ability to drink. So if this child is brought in, is irritable, and is drinking the ORS very eagerly, then okay, this child is dehydrated but not very dehydrated. Once they start going into severe dehydrated, they actually start drinking poorly, if not even infusing the ORS, because they're actually too sick and might not even have the energy to do so. So actually a child who comes in and is failing to drink the ORS, that's actually a sign that the child is very sick. And these are the children now that we put on a drip. Okay. So these are the children that we put on a drip. If it's at a local clinic where they don't have means to administer a drip, they can actually put a tube through the mouth, and that tube actually goes into the stomach. We call those an orogastric tube or a nasogastric tube if we push it through the nose. And they can start actually giving the ORS through that tube. But for the lower centers that have no means to administer a drip, those are children that are advisable to be referred immediately to a higher center, for instance here in Lusaka, to the first level hospitals or to UTH for further management of that dehydration with the help of a drip. Okay.
Just to illustrate the seriousness of what you're talking about here, and of course the seriousness of the condition, diarrhea, how, if not attended to, if a child hasn't been taken to the hospital and perhaps not any remedial measures has been put in place, how long does it take just to have, for example, a fetal issue?
Okay, so diarrhea really is an acute disease. So basically when we talk of an acute disease, of course there are various types. It could also be persistent or even going into chronic, depending if it's associated with other problems. But most of the diarrhea diseases that we see are actually acute diarrhea diseases. And remember, if we use the term acute in a disease, we are saying this is a disease that occurs at a very short period of time. And diseases that are considered to be acute might actually lead to deterioration at a very fast rate. So really, what determines the rate at which a child with diarrhea deteriorates is, one, the losses. If this is a child who is having, take for instance, in an hour already has had 5 episodes, this is a child who in the next 2 or 3 hours can actually die. Okay, so actually it depends on the losses and how frequent this child is losing fluid. Because if they're vomiting and they're losing a lot of fluid within the shortest possible time, this child can do what? Can demise. Take for instance cholera. Cholera patients can die within 30 minutes because in that period they can lose so much fluid that they even go into shock, and if nothing is done, the patient can die. So even acute diarrheal diseases in children are basically the same. They need to be addressed very aggressively because a child can deteriorate very quickly and decompensate within a few hours. Even within an hour or 2, a child can actually go into shock and die if the diarrhea is not attended to and if the losses are so significant. So every loss should be taken with the seriousness that it deserves and replace the fluids. Okay.
How do we prevent diarrhea?
Okay, so prevention of diarrhea, as I mentioned, it's actually just working in reverse. You remember the risk factors we mentioned earlier on? So basically, if you want to prevent diarrhea, you just attend to those risk factors that we did mention. I can give you the example of the cholera outbreak that we had. We saw that the government intervened very swiftly. They deployed the men in uniform, cleaned around the city, and also the local authorities came in also to try and make sure that there is improved sanitation vis-a-vis improvement of toilets in the central business area. So basically, the principles of addressing all diarrheal diseases are very similar. I did mention that one of the biggest risk factors is access to clean water and sanitation. Take for instance, in quite a number of our compounds, there's a lot of garbage. They don't have proper sanitation. They've got these shallow latrines, and when the rains come, all those latrines flood, and all that water is all around, and garbage is decomposing all around. And this is the same environment in which these babies play around and even crawl. And remember, for babies below a certain age, anything that they touch comes to the mouth. So really, the first thing is improved water and sanitation. Then for the very small ones, because the commonest cause is rotavirus, and apparently rotavirus is ubiquitous. What I mean by ubiquitous, that it's found everywhere. Even in an affluent community, a child can still have rotavirus diarrhea. So immunization, very critical for prevention of diarrheal diseases. So I've mentioned water and sanitation, immunization. And remember, in children also we did mention issues of breastfeeding. So breastfeeding is very important to prevent diarrheal diseases in babies. Then we talked of vitamin A supplementation, very important in preventing diarrheal diseases. And then also for babies, all other vaccines that improve their well-being. Take for instance the measles vaccine. Babies, when they've got measles, they're also at risk of diarrhea, also at risk of malnutrition. So all other vaccines that prevent babies from all other diseases are very important. Then the other thing is optimal nutrition, because remember, it's nutrition that improves the immune system, because without a good immune system, any small disease that comes in, even food that is contaminated with organisms that might not cause disease in a healthy person, they could cause disease in an immune compromised person. This is a person whose immune system is suboptimal. Okay, so basically, those are the critical things that I can mention in the prevention of diarrhea.
Interesting. There is a text here. Is it okay to give a child these energy drinks that have come on the market if a child has diarrhea and has lost some sort of appetite and stuff, and is failing to take ORS, is failing to drink liquids? Is it okay to give drinks, super shakes, maheos and stuff like that?
Okay, so those actually have been a very big problem as far as pediatricians are concerned, because actually most of those fluids, in terms of the actual content that they contain, I think they don't give us all the details that it requires. Take for instance, I can tell you about the super shake, milk shake. They will indicate that there's a bit of milk there, but how much that milk is, those details are not included. And also, these foods are so marketed that mothers tend to think that they're the appropriate foods for babies, but most of them are not. So for a child with diarrhea, any sweetened drinks, they're not very appropriate, because actually they might actually worsen the losses. Because what it is that when you give a very sweet drink or a concentrated drink, I'm sure you've heard of osmosis. So basically, this child is already losing fluid, and then now when you give that very sweet drink, it goes into the lumen of the intestines, and because it's so concentrated, it also now starts helping to pull fluids from the body, because now osmosis is taking place, because the fluid that we have given now, which is in the lumen, is more concentrated. So now this child was already having diarrhea. They end up having what is called osmotic diarrhea. That sweet fluid you have given starts pulling extra fluids from the tissues. So actually, sweetened drinks are not encouraged. The closest that we encourage is homemade ORS. And mothers that have been taking care of children, they know very well that actually you can get 7 teaspoons of sugar and 1 spoon of salt. You put in a liter of water and mix that, and then you're able to give the child. It might not be the best, because sometimes the dilutions, sometimes mothers might tend to put a bit more of salt, a bit more of that sugar, also again increasing the concentration. But if there's nothing that's available, they could actually make the homemade ORS. But the ORS, the standard ORS sachets, they're actually widely available. And we always encourage mothers, when they go for an under 5 clinic, they could request 1 or 2 sachets to keep in the house. Okay, because diarrheal diseases are very common. And then if the child is not able to tolerate any of that, instead of just sitting and watching the child while trying to seek care, we advise that even just plain water, it could be given, and that can do a lot of good to the child. It might not have all the necessary ingredients that are required, because remember, when this child is in that stool, he's not just losing the water, but he's also losing the electrolytes. So the plain water will not contain the electrolytes, but at least it will contain the water to be able to replace the volume. Yeah.
One issue that keeps on bouncing every week that we come through here is the issue of teething, and of course, I have several messages here requesting you to explain a little that what is the connection between diarrhea and teething.
Okay. So that's a very important phenomenon that a lot of mothers, and of course even a lot of people in the community, know that there is a very close association between teething and diarrhea.
Mm-hmm.
Each time a child is teething, they will see a bit of diarrhea and that sort of a thing. And each time a child comes with diarrhea around a certain age group, the mothers will be asking, could it just be that it's associated with teething? Okay. So it is very true that actually teething is associated with diarrhea. But it's not actually the teething itself that is associated with diarrhea. It's actually the period at which this occurs. You will realize that teething starts to occur at about 6 months, somewhere there. And at the same time, around 6 months there, that's the time that the immune system of the child starts going down. And the immune system of the child starts going down because remember, when a baby is born, or when they're in the mother, they depend purely on the mother for everything, including nutrients, oxygen, and everything. So at the time that a child is born, the mother also passes some protective immunoglobulins. These are just substances that help to protect us and the babies from diseases. So this mother passes some immunoglobulins to the baby through the placenta. So for the first 6 months, this baby is fairly well protected from quite a number of conditions because of these agents that the baby got from the mother. But at about 6 months, these agents start doing what? Start going down. They start reducing or diminishing. And this coincides with the time that the baby starts teething. So already the baby is a bit immunocompromised at that particular time because the maternal antibodies are going down. And also remember, when a baby is teething, they tend to have a bit of irritation in the gums. Okay. So because of that irritation, they tend to put their fingers in their mouth most of the time, tend to bite on anything that they come across, bite on furniture, bite on this. And in the process, because of that irritation in the mouth, as they're all trying to scratch the irritation, they tend to expose themselves to a lot of dirt and infection. And by so doing, they develop diarrhea. So it's not the teething itself, but it's the activities around the time of the teething. Vis-a-vis the irritation, making them bite any stick they pick, put their fingers in the mouth, bite on furniture, and all sorts of things. By so doing, exposing them to organisms or dirt that can cause diarrhea.
Wow, Dr. Namushi, thank you so much.
Thank you. It's my pleasure.
It's been very helpful today. I can see quite a lot of feedback coming in. Parents appreciating the fact that, wow, they've taken much of the points you've said. Thank you so much. Hopefully that you can be available for another edition as well.
Thank you so much. We are here to serve the community and educate each other.
All right, so ladies and gentlemen, today's topic has been diarrhea, and I'm sure that it's been quite an interesting topic. Quite a lot of questions coming in. Remember that one of the episodes in the subsequent episodes coming will address the issue of teething again, so that at least those parents who missed up on that particular episode when we were discussing it, you could actually be able to follow through as well. And another one has to do with colic. I think I've been receiving quite a lot of feedback in terms of colic. And when we're talking about colic, we're simply talking about, when children are growing up, they usually have a lot of issues to do with their stomachs. We find that children tend to cry a lot because of stomach pain and so on and so forth. That condition is called colic. So one of the doctors will be coming through to come and discuss colic in detail as well. So we still have a lot. We still have malaria coming up. We still have pulmonary TB coming up, and a lot otherwise. So make sure that every Sunday between 13 and 14 you make a date with us. But today, the highlights of today, we discussed what are the symptoms of diarrhea. What are the risk factors of diarrhea? How does diarrhea come about in a child who is just, who is usually behind the mother's back a lot? How do they develop diarrhea? What are the causes? What are the risk factors? How it is diagnosed? And of course, how you can prevent diarrhea and how diarrhea can be treated as well. Remember, treatment only happens with health caregivers. So you need to take your child to the hospital if in case you realize that your child has got severe diarrhea or even just acute diarrhea. You need to take your child to the hospital so that they can definitely be able to acquire professional help. And of course, on top of that, remember that the first line of defense is to replace the water that the child is losing through getting a sachet of ORS. It's very affordable, and if you cannot manage to buy, you can as well make. I'm sure these are some of the things that you are taught when you go for antenatal. If you're a father out there and if you don't know how to make, those are the reasons why nowadays the usual advice that try to take time to escort your wife to the antenatal, so that some of these things they talk to you about them as a couple. It really helps, and of course it helps to, it helps you work as a team as well. We'll be back next week, and of course another one will be coming up, and it could be malaria and it could be pulmonary TB as well. These are common infections that usually affect children, so make sure that you make a date with us every single Sunday between 13 and 14. Thank you so much.